On the news briefing for this Wednesday. We will start with our COVID-19 information, and we have Dr. Moreno with us as we do each Wednesday. Hello, Dr. Moreno. And if you're the call-in, you are muted. Dr. Moreno.
Now?
Oh, there you are. Hi, Dr. Moreno.
Yeah. It's the double unmute feature. Okay, I'm here.
Thanks very much for taking part today with our COVID-19 information. I'm assuming you're ready to take questions.
Yes.
All right. Here's our first question for you, Dr. Moreno. Does the end of the COVID-19 emergency declarations at the state level mean that the COVID-19 pandemic has ended?
Thanks, Matt. So we still have transmission of COVID-19 and here in Monterey County in California in the United States, and we still have a pandemic declared by the World Health Organization. So the pandemic is still with us. We still have transmission of COVID-19, regardless of whether there's a state or local emergency in place.
Thank you, Dr. Moreno. Next question. With the state ending the COVID-19 emergency declaration this week, what effect will that have on Monterey County Department of Public Health regarding the virus?
With the declarations in place, Monterey County Public Health has continued to do what we can to make the public aware of the actions they can take to prevent COVID-19, and we've been able to serve as a resource to schools and businesses as well. When emergencies are terminated, public health will continue to make information available as we can to the public on how to reduce the spread of COVID-19, and we will continue to be a resource to primarily schools and businesses on how to prevent transmission at their locations.
Thank you, Dr. Moreno. Next question. What can people expect to be different when Monterey County lifts its emergency declaration? And I think this would definitely just be referring to public health.
Yeah, so as I just mentioned, we'll continue to be a resource to the public, schools, and businesses. If individuals have questions of the impact of ending declarations that ending declarations may have, I suggest they contact their employer, contact the school, contact any agency that they work with to find out what the impacts may be.
Thank you, Dr. Moreno. Next question. Will public health continue to make recommendations regarding COVID-19 after the county has ended its emergency declaration?
At this time, public health is still aligned with the state with regards to recommendations for COVID-19. Thanks. All
right. Let's see if there's one more question for you, Dr. Moreno. Yes. Will the state and county end to its COVID-19 emergency declaration mean the end of monitoring COVID-19 in the community?
Thank you for the question. Again, this would be limited just to public health. We continue to receive reports of COVID-19 cases from various sources here in Monterey County, primarily healthcare providers, and we will continue to receive reports as we continue to receive reports of other diseases that are reportable in Monterey County.
Thank you, Dr. Moreno. Any other questions for Dr. Moreno today? And I see Karen Smith is on the line with us. I wanted to quickly share this graphic that we have about an upcoming vaccination clinic that Public Health is putting on. And Karen, is there anything you want to say about this this clinic that's coming up? We've got one this Saturday, and then each Saturday for the next several months.
Yes, I just want to encourage people who maybe need their flu vaccine. It's not too late to get that vaccination. And your boosters. It's important people get boosted. So those are available, and it's available free of charge, regardless. 6 months and up. Just the only thing is minors need to have a parent or guardian with them. But it's a great opportunity to catch up on that last booster that you might have missed, or start, or whatever you need.
All right. Thank you very much, Karen. I just wanted to drop that in there because we just got the announcement of that clinic for the Saturday, and we wanted to share it with everyone. And Dr. Moreno, I see no more questions for you. So thanks very much for dropping in as you have and providing COVID-19 information.
Okay, you're welcome, ma'am.
So we're going to move on to our next topic, and it is a little bit related to COVID-19. With the state's COVID state of emergency rescinded and terminated, there may be some changes to some support services that have been extended during the pandemic. And here to tell us about these changes and what it might mean to people who are receiving assistance is Annette Gallegos. She is with our Department of Social Services. And Annette, I understand you have some staff with you today. Tell us more about these changes.
So good afternoon. I'm going to go ahead and share my screen. I have a short PowerPoint.
Terrific.
Again, my name is Annette Gallegos, and with me is our medical analyst, Celeste Armijo, who will be assisting me with answering some questions. But due to the upcoming changes, we wanted to let everyone know that there's two changes, one for CalFresh and one for Medi-Cal. So the first one is really our CalFresh recipients are currently receiving supplements, and they receive supplements up to $95 in CalFresh food benefits. And that was known as the CalFresh emergency allotment. And those supplements are ending. So really they did end for the month of February. So the last allotment will be issued on March 26th. So they will go back to receiving their normal allotment that they normally receive monthly. Some households actually will receive a pretty reduced amount because their normal allotment could be something like $20, and they would get up to a maximum for their household, which could be a couple $100s. So they will be going back to that normal amount. There are no hearings rights, so that amount is what they will be receiving. For Medi-Cal, currently we have over 200,000 Medi-Cal recipients, and they have been active without a requirement to really complete their annual redetermination. So our rules have been changed and will be implemented, which will require us to resume the annual redetermination process, which the state is really calling it the continuous coverage unwinding period. So counties will have 14 months to complete all of the annual redeterminations. And that will start on April 1st and will be ending May 31st. So every month, customers who have an annual redetermination will need to complete it and return it. So that will start with our June renewals redeterminations. So April, about mid-April, their packets are issued for the month of June. So they'll go out 60 days prior to the month so that they have time to review it, complete it, and return it to the county. If it is not returned, then those cases will be discontinued. So we have not been discontinuing Medi-Cal benefits for customers. So we will see on July 1st, potentially several hundred, if not thousands of cases being discontinued if they do not provide their annual redetermination. So what we really want is for agencies that have contact with customers that have Medi-Cal. We are sending notifications, the state is, to please update your contact information to ensure if you have Medi-Cal that your Medi-Cal annual redetermination packet is received. So I talked about the state had issues, so they did do a mailing in this month to inform beneficiaries that of the continuous coverage requirement. and the restarting really of the Medi-Cal annual redetermination process. We also have Central California Alliance for Health, who is our managed care provider for our county, and they are sending text messages also to our beneficiaries, informing them to report contact information to the department. DSS has updated our social media and our interactive voice messaging to inform beneficiaries, also to update their contact information. And again, we really want any agency that has contact with customers that they know that have Medi-Cal to ensure that they're reporting any changes, especially their phone number or their address. If anybody that is receiving Medi-Cal, if they have questions, they can call our call center, which is at 877-410-8823. But also our community partners, if we would like to collaborate with them, provide outreach materials, and our outreach staff is, our MC Choice can be contacted at 866-361-0477. We will also be trying to hold a meeting with all of our community partners to give some additional information. But again, if any community partner would like to collaborate further with us, we can go ahead and you can call our number and we will add you to our list. And that's a little bit about what is happening in our department.
Thank you very much, Annette. And then if anyone has questions for Annette, go ahead and put them in chat and we can get her to respond to them. But this is a big change for a lot of people. Annette, would you say, I mean, we have 200,000 people who are recipients and they haven't had to do this redetermination process in quite a while. And they really might be just out of the mindset of having to do it, which is really emphasizing the importance that if they don't, they could lose the benefits that they are entitled to.
Correct. So we have about approximately between 8,000 and 10,000 at least redeterminations that need to be completed every single month. It could be a little bit higher, a little bit lower, but that's approximately how many we have. So I did say over 200,000 recipients, so those are individuals, but cases, we have between 8,000 to 10,000 annual redetermination forms that need to be returned. And we do have in the past, just going by past history, we have had a high number that do not return them. So we really are wanting to encourage everyone to help our customers, make sure that they have the correct address, because it has been a while.
And what is involved for the recipient? What is involved in the redetermination? What is it that they need to provide? Is it a long process or is it just a couple of forms?
I'll see if Celeste can answer this question, because there's differences. And our system does do an automated match, but if it can't do the match, then the renewal packet goes out. Celeste, can you explain a little bit about that?
Yes. So there is a process that first we'll try to see if we can reevaluate them without having to send any information to them. So if they provide us current information, or we had current information because they reported it, it will go through the system. And if we can renew them, then they will automatically be renewed for another year without us having to send any packets. If they don't renew, that's when the packet is sent, and basically it's income information that is being requested for them. There is another population where it would be income and property information, and just verifying that anyone who is in the household is still in the household, and reporting any changes if they're receiving any type of income as well.
So the message to recipients is, heed the information that is coming out about these renewals. Don't wait when it's time to do the paperwork or to renew. Just get it done.
Yes.
Correct?
Yes, correct. Yes.
And then
to
they,
go ahead
go
and
ahead.
fill out the
No,
forms, review them, and then turn in any verifications. Because a lot of times that's the portion that is also missing, that the verifications are not sent in with the forms.
Thank you. And thanks very much, both of you, for being on today to talk about this program. Very important for a lot of people in our community to get these benefits. And we really want to keep them flowing if at all possible.
Yes, I just wanted to add, it's almost half of our county, really, if you look at the population size. So we really do want to ensure that we're serving everyone that's eligible and that they continue to receive those benefits that are important for individuals that may not have health coverage.
Thank you both very much for being on today. And then our final topic, the County of Monterey is taking a very creative approach to trying to resolve one very difficult housing situation. And this is encampments of unhoused residents who are living in the Pajaro riverbed. Roxanne Wilson is here. She is our Homeless Services Director, and she's got some information about an interesting and creative plan to help with this. Hi, Roxanne.
Hi, thank you so much. Oh, sorry, it looks like I'm frozen on my side. I'm back. Hello, everybody. I am very excited to present today the encampment resolution funding opportunity and proposal that the Board of Supervisors just approved for me to pursue, I believe it was last week. So I am going to share my screen as well, just to take us through this deck. So give me a sec. The state of California released a new funding stream called the Encampment Resolution Funding Program actually last year with a small pot of funding, and then it was so successful that they decided to add some money into this year's and next year's budget. But the ultimate goal of this funding stream is for jurisdictions or continuums of care to identify an encampment that the jurisdiction or continuum of care feels like should be a priority to try to get people into safe accommodations. The city of Salinas had went for this funding program last year, and they were one of very few jurisdictions that received funding. Sorry. So again, the ultimate goal is for us to identify a group of individuals who are living unsheltered and for us to create a pathway for them to get on a housing, to get housed. Other key components is that it has to be housing first, and housing first essentially means that we believe that there are things that people cannot actually barriers that people cannot address while they're living unsheltered. In many cases, folks cannot work on their sobriety or work on stabilizing their mental health or their physical health while they are living unsheltered. So it's really built on that principle. Another thing is that it has to be one encampment. And also that it has to demonstrate cross systems collaboration and leverage as many local resources as possible. So here's the list of all of the different eligible activities of that funding stream. As you can see, some of this is, we're already doing certain things like street outreach in our community, rapid rehousing. But what I am excited to present today is like a full system that we're proposing for the Pajaro encampment. Just a really quick review of the available funding. Back in 2021, it originally started with $47 million. They later on added $3 million. 2022, the state had increased it to $300 million, of which $150 million is prioritized for proposals that are on state rights of way. And next year, they're looking at a $400 million investment. However, they have not yet explained if there's going to be any priorities over that funding. And just a quick review of the timeline. We did submit last week, the application. We will know by April 30th if we received the funding, and then we have until 2026 for us to fully expend the funds. And as mentioned earlier, we are focusing on the Pajaro River for a variety of reasons, really. The people who are living in the Pajaro River are subjected to annual cleanups. This is really because of the fear that the river will flood. And we saw during the atmospheric river events earlier this year that it is very possible and is very dangerous for people to continue living there. We also want to address the fact that it is a service desert. North Monterey County does not have services for people experiencing homelessness. And there is other things. There's a $400 million levy expansion project that is on its way and slated to begin in 2025. And historically, there was always the assumptions that these folks that live inside of this river are not interested in services, but the outreach team that we have been deploying out there to really get to understand the needs of the population, they've been able to identify already 45 people who are interested in this program if we get funded. What makes it very exciting is that this is a partnership. It's not just Monterey County taking lead, it's Monterey County partnering with the Santa Cruz County Health and Human Services Department, and also the Coalition of Homeless Services Providers, the Pajaro Regional Flood Management Agency, and the City of Watsonville. We have also identified other partners that will help leverage their resources, but we can't get into that. There's so many of them. The components of the project that I'm proposing is outreach engagement, which has already started, as I mentioned. The outreach team has been going out there 2 to 3 times a week, and they often, and what they have been doing is really learning what the people are asking for, understanding why they have not been successful in getting into any other programs, and also establishing that rapport. They have been doing light touch case management since August, and they have been able to get the encampment residents to also name the proposed site, which is called Recurso de Fuerza. So I believe that means resources of strength. The interim housing project, as I have been mentioning, we did identify a church-owned property in Watsonville. So again, that's another partner that is outside of just the regular county leadership. We have been able to engage with the faith-based community. We are proposing 34 to 36 non-congregate low barrier shelter beds with a ton of services layered on top of that, including immigration and citizenship, employment, of course, resources for pets, in homeless services. You always want to consider the partners, the pets, and the property of individuals when you're building out a successful program. Again, mental health, substance use disorder, we will have property storage on site, transportation and physical health services. And then we are also working to make sure that these folks, again, are on a path to permanent housing. So there will be rapid rehousing funds, shelter diversion. There's a home key on the Santa Cruz County side in which folks will have access to. And of course, just doing those creative problem solving exercises, because not everybody requires a homeless services program to end their homelessness as like transitional housing or permanent supportive housing. In many cases, people can be reconnected to family members. So we want to make sure that there are funds included for us to move with those more creative approaches to ending homelessness. Again, we are looking at non-congregate shelters. We have identified Dignity Moves as our partner. They have done these programs across the state of California, utilizing state funds. They are fast. We are looking at people moving in within 6 months of us getting funded and starting the process. The units that we selected are called Boss Cubes. They had the highest fire rating of any similar product that's out there. So that was very important, is safety as well. And then just like a quick projects overview, the project itself is, the ask is $8 million, but the project in total is actually about $10 million when you think of all of the services that are being leveraged. There will be a little bit of an administration fee in which the county would absorb to pay for the number of staff members that it will take for us to implement the grant. And of course, we had submitted the application already, and we are looking at the initial 2-year service, the service grant term, we're looking at serving about 70 people. And then, of course, the County of Santa Cruz is interested in keeping it open, and they're working on finding other ways to sustain this project after the initial project concludes. And I think that that is the end of my deck. I do want to pause and see if there's any questions.
I don't have any questions in chat, but I do have a question. When you talk about 45 people being, 45 people being on the waiting list, or not a waiting list, but an interest list, what percentage of that, of the people who you're targeting, is that a good percentage? Is that a good start?
Oh, it's a great start. They were able to get that list of 45 people in a matter of only a couple of weeks. But unfortunately, in the process of them building up that list, we knew that the storms were coming, and we had to kind of pivot our efforts to moving people out of the rivers and into safe places. But it is my understanding that the folks have started to return, and we have resumed those outreach services. But yeah, it's a great start, especially when there's so many opinions about folks not wanting help. I've been in this industry for about 10 years, and in my experience, people do want help. I think that the issue is that the help that is being offered, it does not really, they don't feel like it's something that could help them personally. So this particular population really does appreciate privacy, which is why we decided to go the non-congregate route. If you really think about even where they're located, the Pajaro River is really big, and people are not actually clustered very close to each other. They're kind of spread out. So this particular population really does appreciate this, and we're going to try it out and see what happens. Project Room Key showed us that, people who were historically service resistant were very much open into going into motel rooms because they were able to maintain their privacy. Just like a regular house resident, we have our preferences of how we want to live in this world. And it's important as folks who are trying to end homelessness for us to listen to people with lived experience and to build our programs based off of their recommendations. And that's exactly what we're doing here.
You had an interesting description of some of the outreach there, which was light touch, which is interesting. Is that part of the making friends, getting to know them? You even got them to name the project.
Yeah.
That just seems that kind of invests them in what the future might be.
Yeah, I think that was important for us, is for them to know that this project is for them. Oftentimes what we've experienced in this sector is folks will do community input sessions with people with lived experience. They get all of the input. And then when the project is built, a lot of those things that the people had voiced as their highest priorities were not actually included into the development of the program. So this was our way of showing them that this is actually for you. And that was exactly it, is trying to get folks to invest in the idea, to prepare themselves for a new beginning and a new opportunity. The light touch that I was mentioning, they do things. The outreach team already does things that are, considerable case management tools, like getting people their IDs and their social security cards and things of that sort. But ultimately, like I mentioned earlier when I was describing housing first, if we do not resolve the housing piece, housing being a social determinant of health, if we do not resolve that, then everything else is built on an unstable foundation. So you need to have that housing component in order for us to see successful goals. And again, just referencing Project Room Key, by the end of what's lovingly called PRK 2.0, when the Continuum of Care was running it, by the time that project sunsetted, there was an 83% positive housing destination, which is that project performed with the best of the best navigation centers. So I think that we're really onto something here, and I'm very excited to partner with the County of Santa Cruz and the City of Watsonville in this endeavor.
It's also interesting that this is really putting a positive, foot forward of resolving an issue when this levee repair work is coming, and you can either wait until everybody's got to leave and you don't know where to put them, or you can put something in place now and solve, get a twofer.
Right. And that's the thing is originally when I was looking at when I first came to the county and I knew the encampment resolution program was included in this year's budget, I started going through all of the encampments and really trying to figure out like where is the highest need. And just knowing that the Pajaro levee project is on its way, these folks are going to get displaced anyway. So this was a great partnership opportunity with the Pajaro Regional Flood Management Agency, Monterey County Water Resource Agency, and also Zone 7 from Santa Cruz County. We've all been talking about this for months, and now the opportunity is here. It was a huge push. It took a ton of work just for us to get all of the right partners, but we do believe that the application is very competitive.
Would you also say that this application is competitive because this program has a life beyond the term of the grant? Because you're putting building blocks in place to keep it going after the work is done, per se.
Right. So we're looking at expanding the capacity of the South Santa Cruz County resources. And the reason why Monterey County is taking the lead on this is because we understand that there's a lot of folks who are Monterey County residents that are living on that river, whether they associate themselves with our county or not. It is a true statement. So the only way for us to be effective is for us to do this together and to break down, that historical for us to just kind of remove the county border and just think about it like what are our actual objectives and let the objective drive us. But you're right, we're talking about building something that will be there for a very, very long time and help people far beyond the 70 that we're planning on helping during this project.
Thank you, Roxanne. And is there any last word that you'd like to have?
Not specifically about this, everybody should wish us luck, that is a thing. But I do also want to mention that I am working with the city of Monterey, and we are going to be doing a community input session to see how the two municipalities can work together to address the homeless crisis that people are experiencing over on the peninsula. So that is going to be, I'm going to share this, and then I think I did send it over to you. Give me a sec.
And I will follow. I will send it out afterwards as well to our partners.
So thank you so much. It is going to be at the Monterey Public Library on Wednesday, April 5th from 6 to 7:30. I do ask that this gets out. We want to hear from everybody from all walks of life because ultimately, we can't do it by ourselves. Us, the city, nobody can do it by themselves. We really need the entire community at large to lean in and help us do better in general.
Thank you very much, Roxanne, as always, for joining us. And thanks, everyone, for sharing information today on the news briefing. Our next briefing is next week. We'll see you then.